Good morning, folks. I thought I'd take this opportunity to discuss the mask mandate and also an update on winter housing for unsheltered residents. So the mask mandate will be lifted on November 8th, 2021. This is a result of the first 30-day review of this mask mandate based on having put it in effect on 9/20/21. We've seen a significant decline in the prevalence of COVID-19 in the last month versus the month of September and early October. And further, due to the contact tracing efforts here in the city of, by the city's health department in Greenfield. They do keep up with our numbers quite well. So as of today, there are a total of 7 cases in Greenfield. As we know, that can change, and we do base our information on the state, which can lag behind. But it was all in all, or is all in all, a good sign. Masks will remain required while doing business within the City Hall. And I'd like to also take a moment here, speaking of doing business in City Hall, to talk about courtesy and kindness as well. We ask everyone to be accepting and kind to people who are exercising their right to wear a mask in public. And please do not call or show up at our City Hall and berate the staff because of masks, vaccines, needing your paperwork ASAP, your taxes, your dog license, or anything else. All of those things are available to you here in City Hall and online. Many of those things are also available online. But I think it suffices to say that from time to time, our employees in the collector treasurer's office and in the city clerk's office in particular do have to handle some very unpleasant situations. So in keeping, they're basically here to help you. And they are doing that within the boundaries of their jobs and often under state laws and regulations. There are some things that just cannot be done ASAP. You might have to wait a day or so. Best to call ahead if you want to make an appointment for a dog license or pay your marriage intentions and so forth. And they can maybe set up an appointment for you at a specific time. But if you do show up, just please keep in mind they are here to help you. They are not here to take abuse. Despite the fact that the city is dropping the mask mandate, I want to make it clear that private businesses who wish to continue to require masks in their establishments will have the full support of the city of Greenfield behind them. In fact, at least a half dozen privately owned companies with locations in Greenfield have corporate policies requiring masks, including several large retailers and chain restaurants. In keeping with the requirements of local business, we urge you to comply with their corporate requirements for the health and safety of their employees. I also encourage you to continue to wear your mask if you are in public and you feel it is in your best interest, especially when you are in enclosed spaces with fairly large crowds and you are unaware of people's vaccination status, or you cannot easily social distance. Mask wearing not only protects you, but it protects others. And remember, many children are still unvaccinated. As far as vaccinations go, I also want to make it very clear that the best way for us to get ahead of this pandemic is for everyone to get vaccinated. Despite hosting 51 days at our Greenfield Run vaccination clinic and having many locations where vaccines are available, we still see that the residents of Greenfield are 64% fully vaccinated. Those of you who have one vaccine are at 73%. You can compare that with the state's average of 69.4%, and to some of our neighbors. In Vermont, it's 71%, in New York State, 66%, and in Connecticut, 70%. Locally, just a minute, the communities of Bernardston are at 62%, Deerfield at 79%, Gill at 66%, Sunderland 67%, and Hatfield 74%. East Hampton and Northampton are both 71%. So once again, I do encourage you to go get your vaccinations. If you're ready for your booster, you can also begin to start making appointments for those at local pharmacies. As for winter and our preparations for our unsheltered residents, municipal staff, Health Director Jennifer Hoffman, Laura Gordon, and Officer Green of the Greenfield Police Department, and MJ Adams of the Community and Economic Development Department have been working with our local community partners, the Opioid Task Force, the Salvation Army, ServiceNet, Greenfield Housing Authority, Elliott Homeless Outreach Services, Community Action of Pioneer Valley, Continuum of Care, and the Western Mass Coalition for Homelessness, to identify the gaps that expose our most vulnerable citizens to cold weather risk. We understand that the shelter is at capacity, but there are active efforts with some new funding in the works by our partners that we just identified to identify and make available additional winter sheltering options in the region. Public places like the library, the transit center, and some community businesses and organizations are open more hours than they were last winter. But we recognize the need for additional options, especially on the weekends. Some other things that will happen: public porta potties will remain at the Energy Park and near the parking garage. ServiceNet reports that the Wells Street shelter will remain open 24/7 through the winter months. In addition to the shelter, the Wells Street site also operates the Homeless Resource Center during the week. The Salvation Army on Chapman Street is open Monday through Friday, and we are working with the Salvation Army to open for additional hours on the weekend. The living room on High Street and the Recovery Learning Center on Chapman are also options. The city has updated our resource card with a great deal of information, and it is on sheltering. And it's also available online and in hard copy. Our Greenfield Local Police Department and police officers generally carry the resource cards with them. We're also working with the Greenfield Housing Authority to provide resources for additional program staff to support housing and stability for some of Greenfield's vulnerable residents. This work is being done along with an organization called GAMHA, GAAMHA, which stands for Gardner Athol Area Mental Health Association. And they are doing, we're working with them to improve the environment and residential culture at the Winslow here on Main Street. I look forward to a long relationship with GAMHA. They are an excellent community resource for our unsheltered individuals. And that's about it.